It is great pleasure that InMode presents Dr. Pier Paolo Rovatti. Dr. Rovatti is a plastic surgeon operating from Italy with extensive experience using the BodyTite and FaceTite platform. With his experience and expertise, he has been able to develop a technique that works well for him. More specifically, his entry point is inferior and medial to the oral commissure and submandibular. The purpose of this access port is to insert the FaceTite electrode superiorly and away from the marginal mandibular nerve branch. This access will allow treatment of jowls and lateral cheeks. And at the end of this didactic, a complete FaceTite treatment.
My name is Pier Paolo Rovatti. I come from Italy. I'm a plastic surgeon. And my experience with BodyTite, with this device, is 7 years that I use it. I come from an experience with thermal devices. I started with laser, but now I think with radio frequencies we had the maximum heat and the maximum effect that we can have on the face and on the body. I think that the face is one of our targets. It's the most important target of a plastic surgeon. You know, many people come to do procedure on the face, and I did in these years more than 600 of procedure with BodyTite. And I think really I understand now that heat is the future. Is a procedure that can do what we didn't do in the last month, in the last years. So when we make a facelift, a neck lift, we cut and we pull the skin and we damage the skin just a little more than we can do. So when now we have heat, the thermal effect, the tightening of the skin is just going through the ears and going back with the ears. So now the skin is better with heat because it's much more hard, it's much more tight. And the effect, I think the future will be all the devices are going with heat and with this thermal effect. So another important effect of the thermal is the neocollagenesis, this production of collagen. So the skin will be better even because there is a production of new collagen that in 3, 4, 6 months until 1 year is possible to have. The aging of the face, we are speaking now about the face, is particularly evident on the lower third because many women, they don't love the bulldog face when they have the jaws sagging, and they don't like it. But now we can do without cutting, without making a neck lift, we can have a beautiful and nice effect just with small hole behind the jawline. This device, in my experience, I have been all over the world to train, to teach this technique, and I think that everybody all over the world, they are really interested in this technique. So in Asia, instead of East Europe and all Europe, they like and they want to learn more about these devices. I think that our aging of the face is particularly evident on the jawline. When the jawline is not very tight, you see that there is an aging face. And we do exactly what we need. So we put the jawline straight and we melt a little the fat, and so we have the skin going back, going tightening, going firmly, because even when we have a double chin or a big fat neck, so when we bend our face, sometimes we have the skin sagging. So when we have much more firm, when we have this skin more hard, there is a hardness more of a subcutaneous tissue. When we bend our face and when we bend the neck, so we don't have this skin, this sagging skin. And this is very important for the people. So I think we must think different our future of surgery. So surgery will be not excisional surgery, but a no-invasive surgery is what they want. So I think another important thing about this device is the safe device. The safety is really important because when we do this, we have many controls that stop our device while we are working. So if I am on the surface, if I go too slow, I have some noises that tell me that I'm doing not the right things. So, and another advantage is no scar. You know, small holes, just 3-4 millimeters. Another important thing is less downtime. The people can go out after 3-4 days and they are not so swelling and not hematomas and no erythema, so they can go out. We are doing this, and so for the jawline we have now the treatment guidelines, and even for the neck, just speaking about face. So we must have this fanning retrograde technique that is really interesting. So we have a device that we enter just in the subcutaneous fat tissue, and we go slow in back, and we release energy, heat. So we see immediately what we are doing. We can model the fat, and so modeling the skin. So especially when we have the neck, like, you know, the turkey neck. This is a very popular, famous neck that all the women don't like so much. And we can treat and make an angle in the neck just with this instead of surgery. So it's easier with this technique instead of surgery. What are the zones that we treat? Usually we treat all the neck, the fat neck. We treat the jawline. We can treat also the big fat cheek. And so I think we can also treat the upper face. But usually the importance of a lower third on the face is the most attractive and most important things, and we need to do more on the lower third. So what is important to say that there is a learning curve for the surgeon relatively short. It's not so long. You need to understand, yes, the guidelines, and to understand that you have a device that gives you a big energy. So you must pay attention for the first time, but I think that after a few times that you do, you understand exactly what can give you more than a scalpel. The contraction of the fat is most important things. I think even in the body, in this period, we have we have given much more importance to the tightening of fat instead of getting off the fat, instead of getting empty the abdomen, the legs. So after we have the skin sagging, and this is what they don't like. The patients don't like this one. They prefer the tightening of the skin. And so our target is the fat. If we make a tightening of the fat, so we can have a great effect on the skin. So what about the technique? It's really important to say that we have 2 points really dangerous, and we must know. Everyone can know that here there is the marginal nerve, but it's very deep. And when we have this device, among the 2 electrodes, I have a power, I have a heat. So if I know this, I know that below on this device I can do damage, I can do any nerve injury. So I can stay on the surface and I can treat my fat among the 2 electrodes, and so I will be safe. Another point where there is a nerve can have an injury is this one. And so if we know that here there is a nerve, we avoid it, because here we don't need a tightening effort. So when we mark the scene on the face of the patients, so we avoid this part, and so we will treat only the line of the jaw, just below, and after we do on the jawline much more effort just below the jawline. Now we have spoken about the jawline, but so we must speak also about the neck. The neck, we have a middle point where we enter, and our handpiece go in the neck, just on the supratismal fat of the neck. When we do this part of the neck, we have the guidelines, so we treat just above the thyroid, and we don't go over. And we treat all this part, and we stay deep, and after we can do on the surface near the skin. And we have the guidelines about the treatment, so we don't pass more than 3 kilojoules, not more, because we don't need too much heat. For the jawline, I use now, since a few years, a small hole here, near the jaw and below the jaw. So I think that I cannot have the problem that I had a few cases when I did from this side. Because if you enter from this side and you go, maybe you can find some nerves. And so I prefer to stay here and to know that my nerve is here, is back, and I will not go there. I will treat all this part just with this hole, and this hole is just for the neck. So I can also treat all this part of the neck with the same hole in the middle. The compartments that we treat are just this one in the middle of the neck, and if there is a fat neck, even the lateral part, where I deliver less energy than in the middle. Last but not least, local anesthesia. This is an office procedure. We can do in local anesthesia, and usually we don't pass more than 50 milliliters of Klein solution, little modified. But we have another 2 machines. We do just for the anesthesia, 10 milliliters for side, and 10, 15 milliliters or 20 for the neck. And it's enough. The patients doesn't feel nothing. And we have a procedure that is long 40 minutes, not more. So I have a noise, some beep that can tell me that I'm doing the right thing. So when I reach my cutoff, I have a noise, and so I don't want to look at the device all the time. So I can work, but my ears are listening to the noise, and so they tell me, so now stop or go more. I've never seen in many cases in all these years big side effects. So I think in the first treatment we can have some deformities of a contour, but maybe this is wrong, it is a mistake of a surgeon. So if you keep flatten the area with the other hand, so you keep flattening the skin, you can have the best results. So you cannot have asymmetry of a treatment, because you treat looking at what kind of energy you give and how much energy you deliver. So this is important for the symmetry. Now, if you stay too shallow on the surface of the skin, maybe you can have too much retraction. But I told you before, we must treat in the subcutaneous, and so we must stay deep, at least 5 millimeters. It's really important to speak with the patients, because the first week and the first 15 days sometimes is the swelling can be more than usual, but it's normal. It's normal because when we use energy device, we have much more swelling, and the hardness of subcutaneous is normal. Normally, usually the patients come and say, what happened here is very hard. Yes, it's true, it's good. It's the scar that is retracting. So usually it's long lasting for 1 month, but after it becomes good. The treatment after, when we do this FaceTite, we need for a few days, 3 days, a garment, a compression. You know, we have a compression garment like after the facelift. Just 24 hours a day for 3 days. After, the patients can get off it and can go out. So I think in 15, 20 days, she can wear it just when come back at home, just for a few hours, 3-4 hours at the night. So now as you can see, the cases that now you will look now are about all the lower third, and you can see the neck, the jawline, and especially you will see how we treat this part, and so we have more definition of a line. So it's really important to treat below the jawline to have here the tightening, and just less on the upper the jawline. And what about the neck? The neck are different. Not all have the same neck, and we treat the fat neck, the double chin, and also the neck. Now I'm treating also the neck with not a big fat thickness. I have treated also when I call Mission Impossible cases. You can see now after this some cases that are really difficult, and I don't think that this is our cases for face and neck tight. Usually these are cases for face neck lift, but we wanted to demonstrate, to show that it's possible also to have some results even in these cases. So the device can do the best when we know exactly how and what to treat. I think the conclusion is that it's a safe technique and with a relatively short learning curve for the surgeon. So the most advantages for the patients are less downtime for the surgical procedure and less invasive treatment. So I've seen in these years there is a result long lasting. I see my patients after 5 years, but they are still in a good condition, in a good tightening effect. So this is a surgical result, sometimes more than a surgical result, because you know we are making the skin and the subcutaneous more hard, more tight, more firm. I've seen in 7 years and hundreds of treatment, few complications, few nerve injuries that fortunately they passed with oral therapy. But now I've changed my treatment, so now I don't have more complication. The patients accept this kind of surgery because he understands that is really no invasive treatment, and it's a short time procedure, so it's an office procedure. In 1 hour it's finished. Can stay 1 hour to show if everything is okay and can go home. And local anesthesia is another big advantage because the people, the patients now want local anesthesia. They don't want general anesthesia, they don't like, and they are afraid about this. So last important thing is that now is changing our surgery, and cosmetic medicine is going up. So we must think about the business of the future in aesthetic is changed. And so now everything is changing at the speed of a light. So we must learn that in 2017 now we must use what the technology gave us. So now the doctors are updated if they use radio frequencies, laser, ultrasound, and everything. So I think is going to die the era of scalpel. You know, I think now we can help us with these devices that can do the same thing of what we did in last year.
Non ti solo